Hi, everyone. I'm just going to give everybody a couple minutes to log on. Welcome. All right. Hi, everyone. So my name is Nina Resetkova. I'm going to be talking with you today. We are doing this webinar, so we're on Zoom and we're also live on Facebook. So hi, and thank you to everybody for joining in. We'll be taking a bunch of questions today. The majority of the format is pretty loose. It's just question and answer. But I thought I'd kick it off for just the first couple of minutes with a little bit of an introduction. So first, the introduction to me. Hi, my name's Nina Resetkova. I'm a physician at Boston IVF. I see patients at 2 locations, in the South Shore Center and also out of the North Chelmsford office, so both south and north of the city. And one of my special interests is in caring for the LGBTQ+ community. I'm a strong ally of the community, and this is one of my passions. So happy to be with you today. Happy Pride Month for everybody joining us. We have typically done this as an in-person event. Obviously, the last couple of years we haven't been able to do so, but always very fun. Nice to get the feedback from the audience. Today, we'll be taking lots of questions, so hopefully we'll be able to get to all your questions today. And if your question doesn't happen to get answered today, if we don't have enough time, for example, or if you're thinking about something thereafter, or some questions that you thought of after the fact, don't hesitate to reach out to our marketing team, and they can forward any questions as well. Okay. So a little bit about me. So as I mentioned, I'm a physician at Boston IVF. I'm originally Canadian from Toronto. You may hear the accent a little bit here and there. I did my undergraduate training at McGill University in Montreal. I then went out to the Wild West in Texas and did my medical school training out there, and then did my residency training in obstetrics and gynecology at the Johns Hopkins Hospital in Baltimore, Maryland. And then came out here to Boston IVF and Harvard Medical School to do my fellowship training, and I've since been on faculty heading into my 5th year at Boston IVF here. So that's a little bit of my background. A little bit about you. It's important that when you are selecting a treatment center, you're looking for a partner in care. It's got to be a place where you're going to have respect, you're going to have recognition of your needs, your relationship. You want a center that's going to have a good experience with different types of procedures, particularly caring for the LGBTQ+ population. We are proud at Boston IVF to say that we've been doing that since our inception in the 1980s and 1990s. So we want to partner with you in the process of family building. Things have changed a little bit with COVID in terms of how reproductive health happens. The majority of the appointments that we've had over the last year to year and a half have been virtual appointments. However, that's changing a little bit too as we're opening back up. So there are going to be some in-person appointments available soon. When you are scheduling an appointment for the initial steps, the appointments are generally a 1-hour appointment with a reproductive specialist, like myself. These appointments are intentionally long because there's kind of a lot there's a lot to lay out in the first appointment. Firstly, we need to review yours and potentially your partner's medical history as well. Family history is important, any sort of prior fertility treatments that have been undertaken, any prior testing. We outline a plan for any sort of fertility testing that needs to be done, whether that's evaluation of the uterus, ovaries, sperm, etc. So any sort of fertility testing and timeline for that. And then very importantly, review of potential treatment options, what that looks like and the associated timelines and costs. So it's a fairly thorough appointment, and then it's followed up by any sort of testing plans and then a subsequent follow-up appointment to make a plan for treatment. We are at Boston IVF a full spectrum fertility care center. So we offer full spectrum fertility ranging from just a fertility checkup, evaluating your fertility, discussing fertility options, to, of course, fertility testing, even monitoring of a natural reproductive cycle. We offer insemination, egg freezing, in vitro fertilization or IVF. We offer reciprocal IVF or partner-assisted reproduction. And then we also have a robust program in egg donation and gestational surrogacy as well. So that's a really brief intro, and I'm gonna stop sharing my slides here. I do have a couple of pictures and things that may come up handy if anybody has any relevant questions. And then if you do have any questions, please put them in the Q&A because I can much more easily address them there, okay? All right. So I have my very first question. So we're going to get to the first anonymous question. And the first question asks, anything to consider when finding a donor sperm bank? I assume this is donor sperm bank, actually. But we can talk about egg donation too if anybody is interested in that. And the question asks, are they all the same or should we look for the specifics that are offered? And the answer to that question is they're actually pretty different. There's over 100 sperm banks in the United States, so there's a lot. There are some that are bigger and there are some that are smaller, and they distinguish or pride themselves on that as well. Some of the larger sperm banks are usually named after kind of a geographic location where they come out from. So one is California Cryobank, one is Seattle Sperm Bank. There's also Fairfax Cryobank, Manhattan Cryobank, Cryos as well. These are some of the larger sperm banks. And the way that you kind of distinguish between them are kind of your familiarity with the website and see what kind of search terms there might be. If you're looking for a donor with a particular ethnicity or particular set of accomplishments or personal characteristics, you may want to go with one of the larger sperm banks so you have a little bit more selection. If you have any particular restrictions, you may also want to kind of stay broad and pick a larger sperm bank. But also there are some sperm banks that restrict the number of families that sperm donors can participate in. So if that's important for you, then you can look for a sperm bank that does something like that also. Generally speaking, it's good to go with a sperm bank that does extensive genetic screening on the donors, and many of the larger sperm banks, I know Seattle Sperm Bank, California Cryobank, and Fairfax Cryobank are all using expanded genetic screening of donors. So the donors are screened for hundreds of genetic conditions, which just helps ensure that you or your partner are not going to be carriers for the same condition that the donor is. So it reduces the risk of children being born with any sort of genetic disorders. Okay, so it's just a little bit of additional peace of mind if the donors have gone through more extensive screening. The price of donor sperm can vary quite a bit. If you are going with different types of sperm banks, can vary from as little as $400 to $500 per vial to over $1,000 per vial. So that may affect your decision making. And generally, the larger sperm banks are going to be a little bit on the higher end because they do more in-depth screening of the donors. So I would urge you to at least take a look at a few. Through our website, we have links to California Cryobank and Seattle Sperm Bank. And something important for you to know if you are participating in treatment at Boston IVF is that we do have a limited but reasonable number of donor sperm vials that are available at our Waltham Center for insemination. And if you do purchase one of those, then you save some money on shipping because they're already physically at our center. So if you are interested, definitely take a look through our website at those available donors, so you can save a little bit of money in that way. Okay, good. Okay, so the second question is, does my health insurance cover fertility treatments for LGBTQ plus people? And that depends on your insurance, actually. There are more and more insurers that are covering treatment costs. And there are many that are covering treatment costs without a diagnosis of infertility in the traditional sense, i.e. 6 to 12 months of unprotected intercourse with a sperm producing partner. So if you are interested in finding out, you could contact your insurance, or if you are interested in a fertility evaluation, our financial team can look into that for you and provide the benefits that are available for LGBTQ plus people. More and more insurers are getting really savvy with that and much more encompassing. And so, I would definitely urge you to look into that. Because sometimes it can seem like the cost of fertility treatment is insurmountable, but if there's fertility treatment coverage, it can really, really help make it more affordable, more fair for more people. Okay, so the next question is by Kelsey. Hi, Kelsey. The question is for reciprocal IVF. Also called partner-assisted reproduction. So if the egg donor has a healthy follicle count, will fertility medication still be part of the process? And so we're just learning a little bit about reciprocal IVF. So yes, so Kelsey, if the person who is producing the eggs, so the person who's undergoing the IVF treatment for egg harvesting, even if they have a healthy follicle count and a good follicle pool, great ovarian reserve testing, yes, then they will still need to undergo injections to stimulate the ovaries, because the premise of partner-assisted reproduction, again, is still to get a good number of eggs in order to create surplus embryos that have a good chance of resulting in pregnancy. So we do want to use stimulation medications. That being said, if the reserve is very good, so there's lots of eggs available on the ovary, in some cases we can use fairly low doses of stimulation, and that's beneficial both based on the hormonal effects of the stimulation, but also based on the costs, because the costs of the medications that we use for IVF or for partner-assisted reproduction are pretty pricey. So if you have a favorable egg reserve, then the overall cost of your treatment will be less. That's a great question. Okay. Another question for insemination. So do you typically prescribe progesterone for women after ovulation and insemination? And the answer to that question is it depends. Actually, it depends on whether there's a progesterone issue or there is believed to be a progesterone issue. So those who are over 38 years of age in the female reproductive cycle, there is a decrease in natural production of progesterone. And so there can be utility in supplementing insemination cycles with progesterone, typically vaginally administered, because if you take progesterone orally by mouth, it makes you very sleepy and you don't get a whole lot of it that absorbs. So there is utility in older patients. Also, if there's thought to be a progesterone secretion defect, like a low progesterone secretion, short second phase of the menstrual cycle, then there can be utility to progesterone, but it doesn't need to be universally applied for insemination cycles. So that's a great question. Okay. So the next question is, can you talk about intimacy while going through an IUI? Can you have sex before and after the procedure? So if it's two female partners or two partners with uterus and ovaries, then you can have sexual activity around the time of insemination. If it's a male and female partner, this is the same is true. There isn't any particular risks to having intimacy around the time of insemination. The only time where it would be kind of counter against recommendations would be if there's any procedures that are dilating the cervix or any complicated procedures or complicated insemination where there could be a risk of sort of bacteria moving up through the uterus and into the fallopian tubes and causing ascending infection. So your reproductive team would be able to let you know if there's any concern for infection, and therefore if they recommend avoiding any sort of intimacy, any type of intercourse, or even things like swimming, sitting in hot baths and things like that, that could cause an increased risk of infection. So generally speaking, in an uncomplicated procedure, no, there wouldn't be any intimacy restrictions, but there are circumstances in which it may be helpful to avoid that. Okay. The next question is, if interested in IUI, is an HSG or hysterosalpingogram recommended, or is that only for IVF? So I have my slide deck here, so I'm going to show you what that is so everybody can kind of see what that looks like. Okay, here we go. So I'm going to X out of here. Okay, so here is an HSG or hysterosalpingogram. So let me go to this picture. Okay, so an HSG is it's an X-ray based study, and what we're doing with an HSG is putting a speculum into the vagina, visualizing the cervix, and then putting a catheter through the cervix so dye can be passed into the uterus and fallopian tubes. So what you see here is a uterus that's illuminated with this bright dye on X-ray imaging. And you see an approximately inverted triangle shape, so normal shape to the uterus. You see dye passing through here for the right tube. It's quite long. And then the dye passing through the left tube and then freely spilling into the pelvis. This is the HSG study that they're referring to. So, okay, I'm going to stop the share. Here we are, so I can see the questions. Here we go. And in terms of that study, yes, I would recommend it if you're going to go through with insemination IUI, because it's a very quick study. It takes about 5 or 10 minutes. It gives us a lot of information. It lets us know the shape of your uterus, whether the fallopian tubes are open, and then ultimately, and make sure that you're getting the right bang for your buck, because if you're going to be spending money on purchasing expensive donor sperm, if you're going to be going through, the emotional and the physical toll of going through inseminations, you want to know that your fallopian tubes are open. And even in people who have not had any significant pelvic disease, no pelvic infections, no prior abdominal surgery, there is still about a 5 to 10% chance of having some sort of unexpected tubal disease, which could inform clinical decision making. And so it is important to evaluate the fallopian tubes beforehand. It also gives you a little bit of increased patency, like the diameter of the tubes become a little bit more patent. So it can increase the success rate of treatment with insemination. So yes, I would definitely recommend doing so before going forward with IUI. And the same is true even if you're going to go through with home-based inseminations. It's still very valuable to have the HSG done beforehand. Okay. So the next question is, what fertility test do I provide for LGBTQ plus women? And so the fertility workup, I have another picture for that. So let's go to this. Give you a little bit more context. All right, so this is the first slide. So a pelvic ultrasound is important. Pelvic ultrasound helps to evaluate the shape of the uterus and evaluates the ovaries and counts the number of follicles that are growing simultaneously. So it gives me a better sense of the ovarian reserve. So it's very important. The other testing that I recommend is testing to evaluate ovarian reserve. So if you've done some reading about this, this is going to be the AMH test, anti-Mullerian hormone, follicle stimulating hormone, estrogen levels as well. Some prenatal labs, essentially ensuring that you're healthy for pregnancy, checking your blood count, your blood type, potentially thyroid screening as well, because thyroid disease is implicated in infertility and also irregular cycles, and also increased risk of miscarriage. So very important to evaluate. We do recommend a full STD evaluation as well. Probably also genetic testing, as we spoke about. Those are important. And then I also recommend evaluating the CMV status. Cytomegalovirus, and cytomegalovirus is that very common viral exposure. A lot of us have had it, especially those of us who work in healthcare. It's a virus that you would not know if you've had before. The clinical symptoms are very similar to a common cold. And it does help to choose a donor because if you're negative for CMV, you would want to pick ideally a CMV negative donor as well if you're proceeding with inseminations. And so this is something that provides a little bit more insight into donor sperm selection. And then, of course, the fallopian tube test that we already talked about, the HSG. So those are helpful parts of the evaluation. Okay. Next question is, what are some of my recommendations for alternative therapies, such as acupuncture and diet? And just to help increase the chances of conceiving. So definitely, this is so important, actually. I'm glad somebody brought it up. So the reality is that we do talk about healthy diet, healthy weight, and exercise, because for all of us to have our best, most optimal health and getting prepared for pregnancy, we want to be doing regular exercise. So this means at least 3 to 5 times a week. So regular part of your activity pattern, 30 to 50 minutes of exercise per session. It doesn't have to be, running at a 5-minute mile pace, but it does have to be something that gets your heart rate up, something regular that you can incorporate into your routine. So exercise is very important. As far as diet, there's no fertility specific diet, but the general recommendations are to avoid, high intake of fast foods and processed foods. So we're thinking whole foods, and when you're thinking about the grocery store, you kind of want to be thinking about eating along the outside of the grocery store. That means, lots of fresh fruit, vegetables, so lots of produce, thinking about if dairy, lean meats, if that's part of your diet. If you're vegetarian, making sure you're having a well-rounded diet that's rich in vitamins and minerals and nutrients, lots of protein as well. And then as far as alternative therapies, we at Boston IVF, we have a very encompassing approach to fertility care. So we do have an excellent complementary center, the Domar Center, that's actually, if you walk into our center in the Waltham area, that's right around the registration desk. And we have nutritionists, counselors, and acupuncturists at our center. So that is definitely a part of the treatment here. As far as acupuncture, it's actually very easy to schedule. So you can schedule along the course of your treatments, and you can also schedule both before and after fertility treatments like embryo transfer. So that's very much part of our comprehensive approach to care. Very important. The next question is IVF specific, and the question asks, how many vials of donor sperm are needed for 1 round of IVF? So you can use just 1, but I recommend for my patients to purchase 2. And I'll tell you why. This is getting really detail oriented, but I can tell this person has plans to move forward to IVF. So 2 is recommended because donor sperm vials are meant to be representative and equal. However, in some cases, when we thaw out that vial of donor sperm, it's not going to be as good as initially thought and packaged. And what can happen in that case is when we evaluate the sperm, if the count is lower than expected, we may make a recommendation for a procedure called the ICSI. ICSI broadly means that we're injecting the sperm into the egg. And so if you imagine that this pen is kind of like a catheter, so imagine this is actually microscopic, so scaled up, and there's one sperm directly loaded into that catheter, we would need to inject the sperm through the eggshell to increase the rate of fertilization. This happens if the sperm counts are low, and that procedure is expensive. And so if you purchase a second vial of sperm, in case that situation arises, you have a little bit of protection against the need for a further interventional technique, and you can save a little bit of money on that strategy. And so I do recommend two as a just in case kind of a precaution. And certainly if you don't need to use the second vial, then great, then you have an extra vial left over to help achieve your goals in the future. If you're okay taking a little bit of that extra risk of needing to do that additional procedure, then I think it's okay to have one, but it's a little safer to have a second vial available. And then the next question is a really great question. Do I need infertility testing even if I'm not considered infertile? And so it sort of depends on which treatment approach you're going to go forward with. If you're going to go forward with IVF, anything involving artificial reproductive technology, then you do need a fertility workup because so much of the testing is dependent upon things like egg reserve and sperm count. So it's very important to have those parameters. If you are thinking about going forward with donor sperm insemination, it's valuable. It's actually really valuable testing. In some cases, it can help inform, like in more subtle ways, it can help inform if there's any issues for, let's say, one partner is interested in carrying pregnancy first and her partner is interested in carrying pregnancy second. In some cases, the results of the fertility testing may actually reprioritize some of those goals. And so I think it's really valuable to do the fertility testing beforehand. So, for many people, it's actually covered as part of their insurance coverage for procreative counseling. Even if you may not have coverage for fertility treatment specifically, you may have excellent coverage for procreative counseling, and it can help you get pregnant in many cases, as we talked about with that fallopian tube test as well. So it's very valuable. Do I know if it's common for sperm donors to eventually meet their children if the parents are okay with it? And then this particular question is from somebody who wants their children to ultimately meet their donor if they're open to it. And it can be actually. So when you purchase a sperm from a sperm bank, there are options to essentially select a donor who is interested or open to being contacted. And so you can definitely pick a donor based on some of those criteria. So when you go to a sperm bank, they'll usually have some check boxes, and you want to sort of pick the 3, maybe 4 things that are the most important to you. So if you're picking based on height, ethnicity, educational attainment, open to meeting, not open to meeting, plus 5 other factors, it may be really hard for you to find multiple matches. But picking based on 3 or 4 criteria, I think this is a really important one. You would definitely be able to find a range of people who would be willing to be contacted in the future. So it's definitely something that's possible. This person asks, am I still able to go through with IUI at Boston IVF if my body mass index is over 50? And so the answer to that is generally speaking, yes, if you're medically healthy and if you're approved for pregnancy by your OBGYN and you're generally healthy. We do have a restriction for body mass index when it comes to IVF treatment, and that is over 45 because we are an outpatient surgical center and there can be airway issues for women with a body mass index over 45. And so in that regard, we do have some restrictions that are based on safety in our outpatient surgical center. But we also have a great nutrition program. So I would say, if you're interested in pursuing treatment and you have some weight loss goals, we can help you with that too. But most importantly is your health. So if you're generally healthy, yeah, then yes, you can pursue treatment. I think it's important to know that a lot of, it's important to get healthy. It's important to have a healthy lifestyle, but it's also difficult, to lose weight and hit a certain number by a certain time. And sometimes fertility is more important, so we definitely have, options to help. So if you have any questions, happy to help in your endeavors. Next question. We have a lot of questions coming in. So if a couple is considering using a known sperm donor, can I give an overview of the necessary or suggested steps, including counseling and legal? So using a known sperm donor is possible, but it is complex. Okay. You do need to have legal counsel for this. So you do need to meet with a reproductive attorney to make sure that you have a really ironclad document regarding parental rights and things like that. There is also a quarantine period that needs to be fulfilled through a sperm cryobank that requires a sperm freeze with STD testing and then repeat STD testing, typically at 3 or 6 month intervals, most commonly 6 month intervals for clearance from the FDA. And then the donor has to be deemed eligible to donate based on the FDA criteria. So it's a cumbersome, time-intensive process, but it is absolutely possible. There are costs associated with it in the realm of thousands of dollars when you factor in legal and the storage over that time frame. And there are some costs to release the sperm to the fertility treatment center, but it's absolutely possible and absolutely doable. We've helped many families proceed with known sperm donation this way. The next question comes from Erica. Erica says, every woman's different, of course, but if we decided to use donor eggs, egg donation, what tests can the recipient expect to go through and what purpose do they serve? So this is the recipient of the the donor eggs. The donor makes sense, but we're not 100% sure on what testing the recipient would need. Okay, so if you're going forward with egg donation, then we want to make sure that you are healthy for pregnancy. So some of that preconception testing that I spoke about before, thyroid screening, checking blood count, blood type, STD testing, that's all important. So that's simple blood work, making sure your pelvic anatomy is normal, making sure the uterus is free of any irregular tissue and significant fibroids that can disturb proper implantation of an embryo. So generally speaking, that test is like a saline sonogram or a Hycosi procedure or an HSG to evaluate the uterine cavity. So those tests are important. Also, there's some social work and psychologic screening that accompanies that, and that is all part of our center. So we offer full service egg donation care. But the anatomic testing is fairly straightforward and can definitely be done over the course of one reproductive cycle. And I think what's worth mentioning too is if you are the recipient of a donor egg, you don't necessarily have to still have regular menstrual cycles. Some of our patients who are receiving donor eggs are menopausal or postmenopausal, and there's hormone treatment that can get you ready for receiving a donor egg. That's actually quite straightforward. So great question. Okay. Next question. What are options for a single woman? So the options are quite broad for single women. So of course, fertility checkup. If you're not ready to start your family right away, but want to get some kind of answers about your fertility status, so fertility checkup and evaluation. Egg freezing is a great option if you want to defer fertility. You can also create embryos. You don't just have to create eggs. You can also do IVF treatment if there's any indication for IVF, or you can also do embryo creation with genetic testing of embryos. Egg donation is also an option if you no longer have a good pool of eggs that are available. So actually a lot of options for single women or single parents by choice. Yesenia asks, are there any types of exercise you would ask us to stay away from, like CrossFit, while going through IVF? Great question. It's so interesting. A lot more fitness instructors are getting really savvy when it comes to fertility treatment. And there's, fertility yoga classes and things like that, even pretty widespread on some of the fitness apps, and in studio classes too. As far as CrossFit does tend to favor more high impact exercises. So there are definitely elements of CrossFit that you would not want to be doing while in IVF treatment specifically. IVF does involve medications that enlarge the ovaries. It's the purpose to enlarge the ovaries by making multiple eggs. And so not only if you do heavy or hard-hitting exercises, do you have a risk of pain with those, but you actually have a risk of the ovary kind of twisting on its blood supply, which is a pretty serious complication. So while you're in IVF treatment, you want to avoid anything with high impact, jumping up and down, inversions when it comes to yoga practice and things like that, to avoid that complication from happening. And you'll find if you are doing IVF treatment that about 2 or 3 days into the stimulation, you're probably feeling that your ovaries are enlarged. And at that time, you want to kind of take it a little bit easier. Walking, swimming, elliptical, these are very sort of good activities to do while you're in fertility treatments. Next question is, what does it mean if you find a sperm donor you like that is CMV positive? Does it matter if the person carrying is CMV positive or negative? So ideally, the person who is carrying the pregnancy, if they're CMV negative, we will be using a CMV negative donor because it decreases any of this theoretical risk with CMV incompatibility. CMV infection can cause complications to a developing fetus. So although it's not been reported that receiving sperm for a CMV positive donor is likely to cause a CMV infection, because of the potential risks to pregnancy, we generally recommend that if you're CMV negative, that you're picking a CMV negative donor. Although there's certainly reasonable exceptions, particularly if it's very difficult to find a donor who is CMV matched. And with IVF, it's of much less consequence because the amount of seminal fluid that's being transferred is almost negligible. And so it really is a major consideration with insemination, IUI, not so much with IVF treatment. Definitely something you want to discuss with your physician based on your particular clinical situation. Okay, next one. Oh, great. Okay, I gave a talk actually at BU, Boston University, to their student health department, and they said, thank you for the talk, which is great. And they liked the time of the session, which is awesome. Yeah, it's great. I did stay in my office a little later today for the session, but I got to finish up my notes, so that worked out really great. So thank you for your feedback. Erica asks another question. When in the fertility process should a person schedule acupuncture, and how much is it per session? In some cases, acupuncture may be covered by insurance. It's always important for you to check your insurance to see if it is. I have to admit, I don't know the price for acupuncture. So that's something that I have to look into for future sessions. But it's relatively reasonable. A lot of times, as I mentioned, patients will have it done before and after treatment. And so it's reasonable. Then as far as when to do it, so if you're somebody who wants to incorporate acupuncture through the course of your treatment, generally they recommend weekly treatment. So you're coming in every week through the course. If you are having an embryo transfer, it would be done before and after the transfer. That's the way it's been best studied in order to increase the blood flow to the uterus. So they use certain acupuncture or acupressure points to permit increased blood flow to the uterus, and that's how it's theorized to improve the chance of a pregnancy potential. So very valuable tool. And again, as I mentioned, easily scheduled through our donor center. The next question is one that is commonly asked and very important too. How many donor sperm vials do you recommend to get for IUI? So I've actually done this type of panel many times in different sort of avenues. One of them I did also with one of the larger sperm banks, and they always recommend starting with 3 to 4. I tend to individualize it a little bit more to my my patients or couples, going through treatment depending on their goals of, how many children they want to have. Do they incorporate doing IVF at any point? Do they intend to incorporate IVF at any point, or are they just planning to move forward with IUI all the way through? Generally speaking, about 3 to 4 per pregnancy attempt is a good place to start, but it honestly depends on how risk averse you are, how likely you think you are to keep track, close tabs on the IUI vial count on the websites, and then also how committed you are to having a genetically matched sibling for future pregnancies. So at minimum, if you're paying for the shipping, I would recommend shipping no less than sort of 2 or 3 at one time, especially if you're interested in having multiple children. If you're purchasing from our inventory of Boston IVF, you could just buy one at a time because you're not paying anything to ship it. Mind you, you would have to restock every month, potentially pick a new donor if you're not pregnant. If you're comfortable paying a little extra out of the gate in order to preserve your best chance of having genetically matched siblings, if you know you want to have more than one child ideally through IUI, then it's safest to purchase 6 to 8 vials. A lot of the sperm banks have buyback programs where you get some portion of your money back as a refund if you don't use it. So it's really important to look into that and be familiar with all the details of their buyback policy, because you're not going to get 100% of your money back, but you might get 50% or 75% back. And you're going to feel pretty good about that, if you need to use those vials of sperm, because the risk is if you don't have enough vials, then you may need to go to a very expensive treatment like IVF to conserve the amount of sperm that you're using to get a genetically matched sibling. And that's expensive. We're talking IVF can be $10,000 or more per treatment cycle. So at that point, you're going to say, gosh, I wish I had bought some extra vials previously. So very important question. Very important to think about, how risk averse you're going to be, how much you're going to be on those websites, keeping track of the remaining vials. And one very important consideration is when you or your partner do achieve pregnancy, check back into that inventory and think about how many cycles it may take you to get pregnant in the next attempt. Talk to your fertility specialist because you may want to stock up at that time to make sure you're not kind of pushed into a corner for your next treatment for your next baby. Okay, so great question. Next question is, where would I prefer to see patients' LH, luteinizing hormone level, when inseminating? And so this would be a question for people who are having monitoring done during their treatment cycles. And so if we're looking for what's called a natural surge, so a natural hormone elevation suggesting that an egg is going to release, then I'd like to see that hormone level get to at least 15 or 20. And this is for somebody who has nice regular cycles. If they have polycystic ovarian syndrome, irregular cycles, then the luteinizing hormone level may not be as meaningful. So if the patient has regular cycles, normal regular cycles, and usually about 15 to 20, and sometimes we'll supplement that hormone level with a medication called a trigger shot to help ascertain, to help ensure that that egg is going to be releasing. So that would be a hormonal approach to inducing ovulation as well. Marie says, what steps, if any, should we be taking before our first appointment? Come as you are. The first appointment should be education for you. It should be an opportunity to, feel comfortable talking about any concerns that you have, talking about your goals and your timelines. And especially when it comes to LGBTQ plus family building, where there may be some inherent challenges, whether they be, financial, anatomic challenges, insurance challenges, I generally recommend you come in a little before you're getting, before you're ready to get started with treatment, if that's at all possible, maybe 3 to 6 months beforehand, just to make sure we're optimizing all factors. You're well counseled, you have time to pick a sperm donor, you don't feel rushed. So that's what I recommend for my patients. And, if you want to just kind of take a little time to delve in to all the details, then you feel like, you have your information when you need it. And then you may have the opportunity to kind of time pregnancy a little bit if we can't always have the plan A come through, but at least we can have some kind of guidance of when you'd like to get started, when would be optimal. So ideally about 3 to 6 months before you're ready to get started with treatment. Okay. Next question is for 2 females who both want to carry a pregnancy, should both undergo blood work and HSG prior to selecting a donor? So it depends. I mean, usually, people kind of want to offset the pregnancies a little bit and not do it like right away or kind of in tandem. So if that's the case, then if you do have an idea of who would like to carry the pregnancy first, then I would recommend that that partner has the HSG done, because it's kind of an uncomfortable test, or it can be. And so that person should be having that anatomic test done as close as possible to starting fertility treatment. And then the partner who's thinking about doing treatment in the future, but maybe not so much in a rush right now, can complete the other testing, the very simple testing with blood work and ultrasound, just to have a sense of where kind of we're starting off from fertility wise, and then save the invasive testing for later. That's sort of my preferred approach. Also, that HSG that I mentioned to you, that kind of gives you a little fertility boost before getting started with treatment. So you want to save that to happen as close to treatment as possible. Next question. Ashley asks, how long do you have to take the medication before egg retrieval? And what are the medications you're required to take to get multiple eggs? So routine IVF, and this also applies for partner-assisted reproduction and egg freezing. Routine stimulation length is about 8 to 12 days. So that means you're taking shots for about 8 to 12 days. The shots are taken in the abdomen and they're subcutaneous. So that means underneath the skin. Generally speaking, for these types of treatments, you don't need to take intramuscular shots and no shots in the buttock, okay? Most of the medications can be taken underneath the skin with a very short needle. If you know anybody who's a diabetic who takes insulin, it's a very similar type of process. Diabetics take insulin many times a day, so these shots are very doable. You're typically taking 1 to 3 shots over the course of that 8 to 12 day period every day. And then in terms of the monitoring involved, you're coming in for blood work and ultrasound every 1 to 4 days. It depends a little bit on where you are in your treatment cycle and how close we're getting to the surgery to remove the eggs, which is the egg retrieval. And then the egg retrievals at our center, they happen in our Waltham Center. Okay, that's where our surgical center is. So anything involving eggs, sperm, embryos always happens in our Waltham Center. Okay, follow us on Instagram. And if, in case anybody's on social, you can check us out there. A couple more questions. We'll try to get through. We have 10 more minutes, so I'll try to do as many as I can. And if you have kind of a question that's, that you want to get answered, we'll try to get back to you. You can get back to our marketing team. They'll try to get back to you, okay? So we have a 34-year-old patient interested in freezing eggs, somebody who's been on testosterone treatment before or currently on testosterone treatment. So if you are on testosterone treatment and you wish to freeze your eggs, come and make an appointment with me. We at Boston IVF are some of the innovators really when it comes to fertility options for transgender men. So if you ever want to have an opinion on this, you're in good hands. We published a landmark paper on fertility treatment options for transmasculine individuals in 2019. The important takeaway here is you may not need to stop your testosterone until you are literally ready to start treatment, then time off testosterone can be limited to as little as a month before having treatment. You may not even need to induce a menstrual cycle before starting treatment. So if you have any questions about this, I'm very happy to consult with you. This is a very active part of my academic work and research, so very happy to help you in this. Mary asks, hello, I'm sorry, just joined. Not sure if you covered this yet, but how do I go about starting to get an IUI? Mary, make an appointment with a fertility specialist. We can do some fertility testing for you. The general timeline is we're booking out about a month. So you should be able to get an appointment at some point in July, possibly even June if there's any last minute availability. But July is very reasonable. You could do your testing with your next reproductive cycle. And then ultimately, once your testing is complete, usually a month later, maybe in August, you can make a plan for treatment. So the earliest timeline is usually about kind of 2 to 3 months after establishing care, assuming that you have an easy time finding a compatible donor, somebody that you're willing to work with. So make an appointment, and then we can do some fertility testing for you, an evaluation, inform you about the treatment options, and then in the meantime, you can start looking into donor sperm options by looking at some of the larger sperm banks online: California Cryobank, Seattle Sperm Bank, Fairfax Cryobank, Cryos Manhattan, or you can take a look at some of the more niche sperm banks in the meantime that may better fit your needs. A patient asks, I have endometriosis and my wife is carrying. Is there higher risk my eggs won't take? It's a great question. There is a slightly higher risk if the eggs are retrieved from somebody who has endometriosis, that the success rates are a little bit impaired. It's not significant, usually in the realm of sort of 5 to 10 percentage points, but there can be slightly worse outcomes if the eggs are coming from somebody who has endometriosis, or potentially implanting with somebody who has endometriosis as well. Success rates are still very good with partner-assisted reproduction, so I wouldn't worry too much about it. And there are things you can do potentially to increase the success rate for embryo transfer, like genetic testing, if that's something you would want to consider. So success rates are still very good if it comes to good egg quality, so don't worry about this too much, okay? We have a point of insight from somebody who works at Blue Cross Blue Shield, and unfortunately acupuncture is not a covered benefit for Blue Cross Blue Shield. So for those of you who have Blue Cross Blue Shield in Massachusetts, unfortunately acupuncture is not a covered service. It's a very good tip from Katya. Hi, Katya. And somebody says, oh, thank you. One of my patients, I guess, is on here. Thanks for doing this. Thanks for coming. Hopefully you get some good insight from here. There's a lot of good questions, actually. How much does it cost to store donor sperm at Boston IVF? So this is a great question. So we are not a long-term storage facility in the same way that a donor sperm bank is, because we have limited space. Okay, so it's a little expensive to store sperm with us. So when it is an option for you to store sperm at the sperm bank, for example, like Seattle Sperm Bank and California Cryobank, they all have local storage options available. I would prefer that you do it there if it's going to be cheaper for you. Storage at our center is for eggs or sperm or embryos. It's about $1,000 per year. So it's pricey. It's parsed out on a per month basis, and it's about $80 to $90 per month. So if you have the option of storing at the national cryobank or the regional cryobank, it's usually going to be cheaper for you. So think about that as well as you're making your reproductive planning. Back to the LH level, does it apply to the urine level as well, or blood only? This would be blood testing. This is serum testing. So that's conventionally when we do testing in the fertility clinic, we are testing in the bloodstream. And then a question about ovulation induction with letrozole. What's the maximum dose I prescribe for my patients? 7.5 milligrams or 3 tablets per day. That's the maximum effective dose. Erica says, might we send out a recording of this session so you can watch again? So we are recording the session. So our marketing team is going to try to get this recorded. I'm hoping, fingers crossed, that it's working. We tried our tech checks and everything, so I'm hoping that we are recording and that it will work. I see that I'm still recording, so we're going to try to get that up for you so you can get some valuable information. And we do these relatively frequently too, so probably at some point in the fall we'll do something similar. So if you have any kind of further questions that pop up, please keep an eye out on our social for these types of sessions. A couple who actually just had their first IUI treatment today, congrats. We're wondering if there's any advice in help making it successful. Take good care of yourself. Stay healthy, stay active, eat well. There's nothing in particular that you need to do, no particular restrictions at this time, except for now that the sperm has been inseminated, you want to be avoiding unnecessary environmental exposures like smoky areas. You want to be avoiding alcohol, any sort of marijuana and things like that. But other than that, just live your best life, take good care of yourself at this time. It's stressful, but it's also a really exciting time. So good luck to you. Does Boston IVF have an opinion on recommending implanting multiple embryos? So we are practice in line with the American Society for Reproductive Medicine, the ASRM. That's our guiding society, and we do have embryo transfer recommendations in line with that. So for most good prognosis patients, this is generally people under the age of 38. We recommend transferring back one embryo at a time. For all patients who are doing genetic testing of embryos, which increases the success rate per embryo transfer, also one embryo. If you're above the age of 38 and not genetically testing embryos, then there are definitely indications for multiple embryo transfer. But we are committed to optimizing, the health, your health, and your offspring's health, your children's health as well. So the safest thing in many cases is to do single embryo transfer as the first line therapy, but there are exceptions to that as well that are notable. So definitely talk with your care professional about that and about your goals. Thank you. When choosing a donor, is there a way to know if they have donated before or will in the future? So yes, there is a way to know this for egg donation, yes, and also for sperm donation, yes. And most sperm donors are donating for multiple times. So yes, so they're going to be typically participating in multiple counts of family building. So and then for egg donors, because egg donors typically donate less number of times because it's an invasive process, then there is quite a bit of transparency about prior treatment outcomes, prior cycle outcomes, and things like that to guide your understanding of how many kind of families have been built with the help of that donor. Okay. All right. Oh, awesome. Okay, so that's amazing. We are at 7:59, and I think we have answered all the questions. That is awesome timing. So thanks for everybody for coming out. I hope this has been helpful. Happy Pride Month. We wish we could be somewhere with you in person, but maybe next year. And if anybody is participating and has a baby in the meantime, then bring your children, please. We'd love to see them. Can't wait to start seeing our families in person again. It's really been a pleasure. So have a great evening and see you next time.